Hey guys, Najaamlee here, CEO, creative director, image, lifestyle coach, and artist over at najaamleeart.com. Also check out Najaam Lee for the makeup and lifestyle coaching. That's najaamlee.com. Alright, so in this video, I am doing another topic for sickle cell. And this one's going to be more about based on different conversations I've had with other people about hospitalization and the changes that we want to see happen. If you remember, just a few months ago, we did a campaign called Speak on Sickle Cell Obama. And that was me and Cassandra Trammell and TJ Brown. We all came together and wanted to do a awareness campaign to reach out to President Obama and really shake up the Capitol, so to speak, and the White House, and really bring sickle cell disease to the forefront and what are the changes that we want to see happen. And we wrote a letter. We all came together, wrote a letter, and sent it to him, speaking about what sickle cell is, what they go through as far as when going to the hospital. We talked about discrimination that happens. We talk about the different stigmas that are out there. We spoke about what we want to see happen. And the whole push on that was to stir the pot, so to speak, and get the awareness on a bigger scale, which it did. We got like over 21 countries involved in the campaign, and this was just on Twitter. We didn't do anything else. We just did on Twitter, social media platforms, and which brought so many people together and really to get the president attention, which it did. We also got him to get his own people to find out what's going on, what this is about. We got other countries that were hearing about what is this campaign of Speak on Sickle Cell. And we got other publications involved that wanted to know more. So we really did bring an awareness at a really great level, but we want to take it higher. So in this conversation, I want us to talk about it. I want us to get it going on what those changes are and why those changes are so important. And one of them I want to talk to about is hospitalization. I think that's one of the biggest things. I don't know if it's the biggest thing, but it's one of the biggest things I know, coming from experience of myself and so many sicklers across the United States. One of the things we experience so badly is through hospitals and hospitalization. And let me break that down. A lot of times when a person goes into a sickle cell crisis and is not able to take care of it at home, after doing all they can do at home, and is not able to take care of, say, in outpatient clinic, a lot of times we have to go inside, which is being admitted as an inpatient in the hospital, and that means being upstairs. They have several different floors, and particularly when it comes to sickle cell, we come under the umbrella of hematology section or department. So they do have a floor for hematology. What is the problem with that? It's not enough floors for hematology. So it's one floor for hematology, one floor for this, one floor for that, and then you have general population. And if they can't get you to a hematology floor, they put you in general population. And that is sometimes when it's the most distressing of a stay. When you're on hematology, you are among other patients that probably take the same medications, going through similar pains or similar symptoms as you are. And the care is a little bit better in a way of you have nurses who work specifically in hematology, understand when a sickler comes in, understand when a cancer patient comes in, understand when a lupus patient comes in, leukemia, you name it, whatever. They understand exactly what to do, how to go about with pain medicine, what's needed, how their pain grows, and everything like that. When you go on to a general population or a general floor, you are dealing with people who have no clue on anything. It's generalized. So people who probably don't have something major going on or on that level. You as a sickler should never be in a general population level. But because when it comes to the lack of beds, the lack of room in the hospital, because sometimes they have an overbook, you get dumped there. You're among nurses, doctors, or physicians. A lot of times it's not head physicians. You are with intern level of, say, not first year, not second year. You're probably with a third year or fourth year going into their type of residency and so forth, going up in their program of becoming a doctor. So a lot of times these particular young ones do not know exactly what they're doing, never really dealt with someone with sickle cell, and have no clue when it comes to administration with pain and pain medication and pain management. Like, they have no clue. That's very frustrating. What's also frustrating is before you get to being admitted, and that's ER, which stands for emergency room. When you go into your emergency room and you're being addressed by, say, when you first walk in, and that's the triad nurses. It all depends who you get. It's really good if there's someone that you work with before to befriend them, but most of the time it's like circulation. Someone brand new comes in and have no clue what's going on, and so it's through the rigmarole. When you go in, it's the first thing they ask you on a scale of how can we help you today. You let them know you have a sickle cell crisis. That should be an alert with a lot of hospitals, especially, but other hospitals who are not really up on it will not put an alert in that you are in a pain crisis. And so they ask you on a scale of 1 to 10, where's your pain? 10 being the highest, 1 being the lowest. As any sickler, and we do know this, that we're not going to come to the hospital if our pain is at a 1, 2, 3, 4, 5, or 6. We usually come in when it starts hitting at a 9, 10. Above that, 11, 12, off the Richter scale is usually how I call it, because a lot of us probably live maybe a 5 or 4. Some of us higher. Like, I know a lot of times, especially in the winter time, I'm probably living at a 7. It's just excruciating during those times for me. So when you go in, the treatment to you is really, really lackadaisical. When you walk into the hospital and you say you're at a 10 with your pain crises, you know, how long has the symptoms been going? Like, these are the main questions that they ask you. And you see them writing and whatever. You get a bracelet put on you, and then you're told to go sit in the lounge and wait. And you're waiting away, and then you're called to go into triage. They take your stats, which is your temperature, your blood pressure, actually about questions, if you're allergic to anything, blah, 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 blah. And then a lot of times you are sent right back out to go sit and wait. And this waiting period, for a lot of hospitals, not all, a lot of hospitals, this waiting period can go on for an hour, 2 hours, 3 hours, 4 hours, and you are in a sickle cell crisis. This is something of this needs to change, you know. The other thing is, once you get inside, it's another waiting period before a physician comes in to see you in your room, right? To find out what's going on with you. A lot of times they'll send in, the first person that you may see would be a nurse who will say, okay, I need you to change it to these Johnnies and blah, blah, blah. The second person that comes in may be a nurse, or if not, it'll be an intern and an intern doctor. And I think one of the most hellish things to go through in an ER situation is that when you say you're in a sickle cell crisis and you are finally in the room that you get in the ER, and you have a port. A port is an automatic system that they're able to draw blood in, is put into your chest area. Because you have no veins as a sickler, your veins are very, very weak. They're just non-functional in a way of drawing blood and whatever things that they need. They're checking how your blood is, what levels, what's going on, blah, 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 if there's any infection and everything like that. So a lot of times you'll see sicklers, a lot of cancer patients, and so much more. Anyone with chronic illness will usually have a port. And you need to make sure whoever accesses it knows what they're doing. That's another thing, because of the lack of training going on. Whoever does not understand accessing your port can ruin your port, can infiltrate your whole bloodstream, and it is a whole nother issue. Okay, but as I'm talking here, I bet you're like wondering, God damn, like all these things are going on. Yes, and I haven't even reached a doctor yet. Intern will come in and ask you a series of questions, right? And then another doctor, if he probably didn't ask the right questions, then the main head doctor that's in there looking overseeing will come in and ask a series of questions. A lot of times it'll be the same questions, or I think it's just a play on making sure the information is straight on, or if they miss something. And that's fine in one aspect. I think the aspect that really bothers me is that they do not check your file, your records, to find out what was done in your previous admissions or your previous ER stay or anything like that. They're just coming in, just blank slate of really not knowing who you are. And most of the time, if you have been a patient at this particular hospital all the time, doesn't matter where you are, if there's probably in a hospital that a sickler will go to all the time on a consistent basis, I really feel that if this person has been coming there, you should be able to really quickly go over their records to really see what's going on, and to then quickly differentiate, if there's any changes, anything different that you have to add on, whether it's doing a EKG or a chest x-ray or an MRI, whatever the situation may be, urine sample, whatever it is, or a particular type of blood test that you need to do. I think that if they would just do that really quickly, and it's not like a lot of these hospitals in technology wise are backwards, where I know there's a lot around the United States that they need to come up. I have traveled all over the United States, been to so many hospitals, and a lot of them are behind time. When I say behind time, in the way they handle their handle patients, especially through ER or admitting or even on the floors, it is back in the 1940s, 1950s, we are still in, of how they go about things. Their records are still, a lot of them are on paper and are not even in computer software at all. And how you access records and access information, especially if you're a doctor, can be backwards on top of that too. So then we're in 2015, but yet working with systems and strategies of 1940s, 1950s, and we can even go further back into some of the things that they do is of the 1900s. And you have to question yourself, what the heck is really going on? When you wonder about certain things, why is the doctor doing this? Why are we taking so long of this? Why are you asking me a bunch of these questions that I've answered over and over and over and over and over again? And you are in pain. And remember this, your pain has not been addressed yet, okay? They're going through this whole thing. And so hours have passed before your symptoms that you came in with have been addressed. Now that's a problem. That is a serious problem that has to change right away. And if it doesn't, that is why so many sicklers that I see that go into ER, a lot of them, and it's sad to say because I have seen this with my own eyes, where some close people that I know that have had sickle cell are dead. They're no longer here. Some of them have been paralyzed. And the reason why some will get paralyzed is a couple of things. There could be other things going on, yes, of course. But a lot of it is taking too long to handle the pain. So when you go to ER, you're sitting there for hours. You're sitting in pain for all those hours. Mind you, you probably didn't bring your meds with you because you are at the hospital to be taken care of, because the meds at home you were taking has not been helping. So imagine sitting in the waiting area about 3-4 hours, and you haven't taken any meds at all during that time. So your crisis is getting worse and worse and worse, and all the other organs are starting to compensate. So the heart's going to beat a lot harder. It's going to expand a little bit to compensate for the slowness of the blood that's going through, the amount of sickling that's happening, and so forth. So then there's a lack of oxygen going through. You're not probably breathing well and as normally like you should. And you probably haven't had any liquids, meaning anything to drink, to help push the blood through, to help in some way, right? Because you're so dehydrated. Okay, so it's a lot that I've said so far just with being in ER and just trying to get some pain meds and pain management happening. So you're waiting and waiting and waiting. And mind you, I haven't even touched overseas. I am just touching the United States with this issue. Right. So I've heard of, there's other things that go on too, of parents with their kids coming in and letting the doctors know, this is what's going on, this is what's happening, my child's in a crisis, it's not going away, we've done this, and for doctors to say, well, to stall on, well, we're not going to give them anything right now, let's see what happens. And a lot of times when that whole point of seeing what's happening, that hesitation, that thing, some of them go into arrest. Some of them end up going into a acute chest syndrome. It goes on and on and on with so many things that does happen, and this is just touching the surface of the ER. I haven't even gone upstairs to really tell you about what happens there. And so I wanted to start a dialogue and open this up and tell me what you've experienced, what you have seen, if this is some of the things that you've gone through. And that you're not able to, the frustration of getting pain medicine in the moment you are in a crisis, you can't move, you're going through so much. Your blood work, after they take your blood work, it shows that you're in a crisis, that this is true. And why I say that, for those that are watching don't really understand, there's this stigma that medical people have put out there for decades. Let me just pull back the century and just put the decades. It's been out there for decades that people of color are drug addicts. And it sounds like something like Donald Trump would say, right? Or imagine now when you are called these things by other people, and that you're a drug addict, and that they get their medicine, they don't even take the medicine that we give them, they get their medicine on the streets. And oh my God, I can go on, and that your pain is all made up in the head. First of all, if I cut my head off, right? Cut it off and die, obviously I am not going to be in pain. I'm dead. So my pain is my head is a part of my body that transits my pain and letting me know there is pain going on. There is sickling going on in the body. So my head has to be a part of it. You know, is it some of the stupid things that are said regarding sickle cell, and that this is a black disease. Oh no, this is a black disease. It is not a color disease. It is a blood disorder, and because it's a blood disorder, sickle cell does not see color when it comes to it. And when I mean color, I mean your skin color. You know, these people gotta stop. And so what happens is, because the government here and the way the system has been created, we've been put in boxes of dynamics of color. Yeah, this goes on in medical industry. Okay, this goes on, and it's sickening. It's stupid. It's disgraceful. It's shameful. And I'm appalled by it, because we're talking about people's health, but yet everyone's still looking at, well, not everyone, I'll say a lot of them are still looking at your color before your health. You get that? Did you just get that? So this is what I want to talk to you guys about. This is what I want to start. These are the things that we have got to continue the work of spreading awareness of what sickle cell is, what it does, that it's colorblind. And you can look on my Instagram. I put pictures up. You can look on speakonsc.org. We put a bunch of pictures up over there. You can talk to any other sickler, talk to doctors, parents, you name it. Put in the hashtag speak on sickle cell or speak on sickle cell Obama. Reach out to all those lists of people that are there and get information and find out if you're really interested, you know, because the more we talk about this, and I know it's been told to me so many times, why are you talking about this? It's something so sad. No one wants to really want to hear that. You know what? I really don't. I have it. I have to hear it. Okay? And millions of others have it. Right? And if we don't speak up about it, this has to become in your ears to the point where things can be done, you know, and changes can happen. When we don't talk about it and we keep it hidden in the closet, no one knows. Life passes by and nothing is done. No new medicine is made. No new progress is done. Nothing. So if we have to talk about it, if you don't want to hear it, change the channel. Because I'm going to continue to talk about it. I'm going to continue to spread awareness about it, because changes need to be done. Go follow me on Paint SC Pain Away. Paint Sickle Cell Pain Away. And that's on Twitter. You can go check it out. That link will be below. As well as Artists with Sickle Cell. If you're an artist or you want to support, whether you paint or sing or act or play music, whatever it is, and you want to be a part, go ahead and join up on Twitter right now of Paint SC Pain Away, and the hashtag that we're using is Artists with Sickle Cell. And that's all down in the description box below. And come out to my show that's going to be happening really soon. It's going to be many of them, called Pain. It's the Pain collection that I created. And it's just about diving into the rabbit hole of pain through my body and my experiences of it. And I'm very excited. So join the RSVP list right now to get all the information, because that's going to be going out really soon. Also, follow me on Instagram at Najaamlee and on Twitter at Najaamlee. And that's about it. So this is just to start it. Let's kick it off. Let's talk about it, because the more we talk, the more we make a change. And we got to make a change with ER and that whole hospital system. it has to change. It really does. My idea is, when a person comes in with sickle cell through ER, there should be a separate section just for them to go to. So you can just have a section for sickle cell only. Since a lot of times people in ER, the doctors in ER, is just too much. They can't handle it because there's a whole lot going on. Pain management is so different than the ones coming in to ER with other issues and stuff, that the best thing would be, let us have a section that is a part of ER, but on another side, and it's just for sicklers, and it is doctors and nurses that just deal on that level for sicklers, and ones in hematology only. And that's it. Make our lives easier and make your life easier that way. Why can't that be done? And also on the floor, instead of making one hematology floor, make 3 hematology floors or 4 hematology floors. One for sicklers and the others for whatever department or other illnesses that's in hematology. Do that. And you know what? Altogether, make a hematology hospital. A hematology hospital. Why not? And it will work because it'll be specific doctors for that only. Instead of going through this whole circular system that's chaotic. Make a hematology hospital. Increase the floors for hematology in hospitals. And that will work. All right, y'all. That's my ideas. Let me know what you think. And I look forward to doing another video with you guys all on sickle cell, chronic pain, chronic illness. I love you guys so much. Thank you for following, and subscribe right here on YouTube for me. Bye.